You're listening to Health Professional Radio. My name is Wayne Buckler, and my guest today is Paul Elmslie. Paul's the founder and chief executive officer of Healthcert International. Welcome to Health Professional Radio, Paul.
G'day, Wayne. How are you? Pleasure to be here.
I'm very well, thank you. Paul, it's not a name, Healthcert International. It's not a name that instantly tells me what it is that you do. Can you give me an idea of what your products and services are and what geographical footprint you are in?
Yeah, definitely. So we work in three distinct areas. We have a medical education arm of the business, primarily based in Australia, but we do deliver courses in the US and online as well. And those medical education courses are postgraduate courses in collaboration with major universities like the University of Queensland or Monash, etc. Focusing on skin cancer, but we also do general office procedures, GP updates, a number of other educational offerings for CPD requirements or CME requirements, depending on which part of the world you live. The second arm of the company is clinics, skin cancer clinics. So these are sub-specialised general practices, focusing on being sort of referral sources or being able to manage skin cancer screening and diagnostic services. They're based in Australia, but currently looking to expand in the United States. And the third arm is teledermatology. So this is telemedicine, but focused on dermatology. And what we have is a piece of bank-level security software where photographs and a history can be taken of a dermatology condition and then sent to a dermatologist who then reports on it and sends a report back to where the case originally came from. And that actually is currently deployed in the NHS in the UK to try and minimise unnecessary hospital referrals is how it's being used at the moment.
Paul, let me unpick those just a little because I'm confused. Why would a highly educated doctor want to do a postgraduate certificate focusing on skin cancer?
Well, I suppose the core reason is that at an undergraduate level, dermatology is typically, let's say it's not very well taught. It's just, like all areas in primary care, you get a little bit of a lot of topics. And dermatology is in most markets is about 10% of all conditions. And most doctors are probably lucky to get 6 lectures in dermatology. So it's something that we've found from our experience that doctors are looking for education. I mean, there's 2,000 different dermatological conditions, and we're obviously not looking to teach all of them, but we want to teach the most common ones because we're looking for primary care physicians or doctors and or nurses for that matter to be able to identify these cases early and then obviously try and help the patient rather than obviously letting it become much worse, and then by the time it gets seen by the dermatologist, it's obviously a lot harder to manage as such. So that's the main reason. Particularly in Australia, when you have a market where 2/3 of the population will be diagnosed with skin cancer by the age of 70. In America, it's 1 in 5. And skin cancer is the most common cancer in the world and the fastest growing cancer in the world. So that was the other reason for focusing on it. And most of our business is focused on skin cancer, but we'll do other education in other areas of medicine.
Now, Paul, you talked about subspecialty clinics. These are general practitioner level clinics or specialist level clinics?
Yeah, no. So in Australia, they're general practitioners. In Australia, there's 450 dermatologists, typically with long waiting lists. So the development of the subspecialised clinic was around getting doctors or GPs that have an interest in obviously dermatology, dermatological conditions, particularly skin cancer, and then putting them through a university certified postgraduate training program to upskill them to be able to manage the low-level cases. So, if obviously a patient has a level 4 melanoma and needs chemotherapy, they're obviously in a hospital. But most skin cancer isn't life-threatening and is typically small in nature. So it's more than able to be managed by a primary care physician in an office-type environment for the vast majority of the cases that do exist out there.
And those clinics are in Australia only at this stage, Paul?
Yeah. So I built a chain of clinics from 1999 to 2006 and then chose to then focus on the education side of it, thinking it would have a much larger multiplier effect as well as helping the community. And then in 2009, got back into building clinics and we've actually built all the documentation, et cetera, for the United States as our next step. So basically taking the subspecialised model into into other markets. And we have been doing work in England for a number of years, and we're also currently negotiating to put a similar model into South Africa at this time as well.
I see. And the third thing you spoke about was telemedicine. Now, telehealth and telemedicine has been a frequent topic for us on the radio. What are you doing there?
Yeah, so about 7 or 8 years ago, I started developing a piece of software, and really it was around giving people in remote areas access to a specialist opinion. I mean, there's nothing worse than having to drive, 600 miles to go and, for a 15-minute consult to find out that what you've got is benign or unnecessary. So my sister actually lives in Darwin and suffers from a skin condition, and for her to get help, she had to fly to Adelaide or Brisbane. And for your listeners who don't know where that is hundreds and thousands of kilometres and probably 2 or 3 days of your life for a 15-minute consult. So we developed the software around the ability to be able to take photographs, and then basically with bank-level security data transfer, taking those photographs and the history and sending it to a dermatologist to get their opinion, and then send it back. And the idea really was around, the good thing about dermatology is it's an external condition. So it's on the outside of the skin. It's easy to see. Typically, most dermatology conditions are treated with oral or topical preparations. So it's fairly easy to also manage. But the doctor just needs to know what it is. So the goal around developing it was to provide people in remote areas access to the same specialist opinion that someone living in the city could get. But realistically, I mean, it is the future of medicine in quite a significant way because, for example, in the United Kingdom, it's been deployed in the NHS to help minimise unnecessary hospital referrals. We did a research project which got published in the BJD about 4 years ago that showed, 57% of all skin cancer referrals to the hospital were not skin cancer, and 82% of melanoma referrals were not melanoma. So there was a large amount of dermatologist time being taken up by cases that were completely unnecessary. And the goal is to use, a system like this to just help, once again, just the waiting lists. And, a specialist doesn't really want to sit there and have to manage cases that completely are unnecessary or perhaps don't need their level of expertise. And what we're trying to do is to help filter that. And, of course, the next step in, the teledermatology side of it will be the direct-to-consumer, where the consumer obviously takes the images and then we'll send them directly to the specialist, is something which obviously we can foresee in the future.
You're listening to Health Professional Radio with Wayne Buckler. My guest today is Paul Elmslie. Paul's the founder and CEO of Healthcert International, and we've been talking about the range of services that Healthcert offers. Paul, most of our listeners are clinicians of one sort or another, often in acute care or in aged care. If they're listening to us today, what's the key message that you'd like them to take away?
Well, I think that, the key message for me is that, as I said before, skin cancer is the most common and fastest growing cancer in the world. And we need every clinician, and whether that's a nurse through to a plastic surgeon or anybody in the profession, to understand what a melanoma does look like. Because whilst you might be there treating the patient for something else, inevitably, when you take the patient's shirt off and you look at their back, you're probably the only one who's actually looking at their back, and you might pick up something that is unusual. And the skill of diagnosing skin cancer, which is called dermatoscopy or dermoscopy, depending on which part of the world you're in, is a very simple skill to learn. I mean, probably in 2 hours, you would know, more than enough to be able to identify an obvious melanoma. So I think for us is that traditionally this knowledge has sort of stayed in the realm of the dermatologist, and obviously that's a great place for it to be. But we do believe that all medical professionals that do come in contact with their patients, it is important that having this base skill is available, and that the scope that is used to look at the skin is basically a handheld scope. For us, we believe it should be as common as a stethoscope. It's just got a 10 times magnifying plate and some LED lights, cheap, and you can buy one and have it for the rest of your life. And to have that around so that when you do find something suspicious, you can look at it, look for specific features. Melanoma has very specific features. And inevitably, when you do find that unusual thing the patient wasn't aware of and pointed out, you could save that patient's life. And for us, we do believe that's an important skill. But traditionally, it's sort of been that situation where that knowledge has been unable to be obtained, and that's what we've been focusing on, obviously, with our education, is to make that knowledge available to anybody at any point in time.
It does sound like a very simple intervention with a very big payoff.
Yeah, look, it is, and it's one of those things that, you learn it once and it's a skill for life, and you'll use it every day. And as I said, if you pick up something that the patient, wasn't aware of, and the difficulty is, I can see the front of me, but I can't see the back of me, and to be honest, I can't even really see all of the front of me either. So, it is really important, we believe, that, everyone in the profession, and so even surgeons, I mean, if you're doing a procedure on a patient and find something unusual, it's very simple to look at it, then be able to make a visual assessment, and then determine whether that might need a biopsy. Skin cancer is relatively easy to diagnose because, of course, it's on the outside of the body, so we can all see it. Just got to have someone looking for it, and then obviously knowing what to look for.
Paul Elmslie, founder and CEO of Healthcert International. My favourite question in every interview: in every occupation and profession, there are misconceptions. What's the biggest misconception amongst your clients and customers that drives you nuts and keeps you awake at night?
Well, I think the main one for me is the misconception that skin cancer is hard. Skin cancer actually is really quite easy as far as, and obviously, once again, in the most common cases are, of course, the 1 in a million, which, probably most dermatologists will never see in their lifetime. But the key thing for me really is that it's very simple to diagnose, it's very simple to treat in most cases, and it's something which will, have a massive impact on the community. And as I said, as we have aging populations, most of the skin cancers that we're diagnosing and managing was sun damage from 20, 30 years ago when, getting a tan to look healthy was still part of our culture. And to be honest with you, in most Western worlds, it is still part of our culture that, to get a tan is to look healthy. So I think the main thing for me is that a lot of, when I deal with different, once again, physician groups, most of them sort of see it as not their domain, and it's not a skill that they could learn or would be too hard to learn. But, my view is that, if you are a clinician and you do come in contact with patients, then, having this particular skill is important. But the misconception is that it's difficult to obtain. As I said, you in 2 hours could be taught something that would, move the needle very significantly in your ability to be able to diagnose skin cancer.
Now, Paul, if people have been listening to us today and would like to get in touch with you, is the website the best way to do that?
Yes, if you go to healthcert.com, so health and then CERT as in certification, so healthcert.com, you'll see the range of courses, but you can also, once again, just do the contact us section and that will come through to me personally. If you did want to contact me directly, then it's just paul@healthcert.com. And obviously would love to be of assistance to any of your listeners at any point in time. Very happy to help.
Thanks, Paul, and thanks for your time today. I'll just mention that website again because I'm constantly getting into trouble for not giving people enough warning when we talk about websites. So pencils ready, listeners. It was www.healthcert.com. My name's Wayne Buckler. This is Health Professional Radio. If you've just missed my conversation with Paul Elmslie, founder and CEO of Healthcert International, the good news is we have a transcript on our website at www.hpr.fm, and you can also find the audio archive on SoundCloud or on YouTube. This is Health Professional Radio. My name's Wayne Buckler.